This hour is presented by Mainstay Financial and Annalee Leonard, who is responsible for the information and opinions expressed during the show.
Hi, this is Financial Advisor of the Year, Jim Brogan of Knoxville, Tennessee. You're listening to Winning with my good friend and colleague, Annalee Leonard.
You're listening to Winning with Annalee. Annalee is a retirement and estate planner, a member of the Ed Slott Master Elite IRA Advisor Group, as well as a sought-after speaker on such topics as income planning, 401k rollovers, and advanced IRA reduction strategies. When not working in her private practice, Annalee joins with other certified senior advisors to promote top-quality services to mature adults in the Pensacola area. Her goal is to help you prepare for and live comfortably in retirement. You can reach her office at 437-3127 or online at mainstaypensacola.com. Or call her now at 437-1620 on Winning with Annalee.
That's the truth.
Oh, well, good morning, Miss Bridget.
Good morning, Joan. How are you?
I'm good. I'm very good today.
Our first solo show.
There we go. That's right. Yeah, I think the last time that I was here with Annalee. And you were here with Wendy.
I was here with Wendy.
Right.
You were on the phone with Quint Studer. We did the Quint Studer interview.
Right. Oh, you remember better than I do.
I remember.
Oh, my goodness.
I have a wicked memory.
You do. I'm going to have to make a note of that. Let me write that down right here. Whoa.
I'll never forget.
Well, good morning, everybody, and welcome to Winning with Annalee. I am your host for the day. My name, again, is Joan Connell, and I am a partner at Mainstay Financial. Annalee and I have Mainstay Financial Group on the corner of Perry and Cervantes, where our whole mission is to educate, enlighten, and empower you to make sound financial decisions, not only for yourself, but for those that you love. Okay, so I know the intro said call Annalee now at 437-3127, but she's not there. She's over at Sacred Heart today. And you know, when it's Sacred Heart Day, Senior Spirit presentation, then that means I'm here to fill in for her. So always a pleasure to be here and getting a little warmed up here because it is darn right chilly out there today.
Chilly and wet.
Oh, I know.
Like the worst combination.
It is. It is the worst combo. It is the worst combo. So anyway, I was hoping after the weekend that we were going to be finished with this little cool weather, but I guess not. But anyway, pretty soon we'll all be saying, oh my gosh, it's so hot. I can't wait till it gets cool.
I know.
So,
it's just the cycle.
That's right. The cycle, cycle runs and runs and runs.
Yeah, it is what it is.
So anyway, I have several different things I want to talk with you about today. And as we go along, if you have questions, please feel free to call the studio at 437-1620. You know, Bridget, 5 years we've been doing this here, and I never get that number right because it's a combination of a couple of numbers that I'm familiar with. So,
I know.
Yeah. So 416-1620.
437-1620.
437. You know what? See, 416-1620 is the number that people call to register to go to a Senior Spirit presentation.
Really?
That's why I get so confused because we've been doing Senior Spirit presentations with Sacred Heart Senior Services since 2002.
Wow.
Since 2002. So Annalee and I can't believe it's been 17 years this year. And we love it because we educate once a month, you know, and it's always a fun thing to do. But that's why I get the numbers all mixed up. So I don't know what I do.
Well, if you want to register for that, that's the number. If you want to call the studio, 437-1620.
437-1620, News Radio 92.3 and 6 FM and 1620 AM. There we go.
I know.
All right.
We're all over the place.
All right. And then, of course, the other confusing part is our office number begins with 437. So you understand why I get confused? You know?
That would trip me up.
Yeah.
I only have one number I need to remember. That and I guess my cell phone.
There you go.
That's locked in.
There you go. Anyway, I'm not going to spend the whole hour today talking about Medicare. I have some other things I want to share with you. But there are a couple of things I want to go over with you about Medicare. And one of the first things is, for those of our listeners out there who are getting ready to turn 65, if you're going to turn 65 this year, in 2019, I want you to be thinking about the fact that, you're going to need to do something to get enrolled in Medicare. Now, if you are not working, or if you, and therefore don't have group health insurance, either because you're working and your employer provides it, or maybe you're covered under your spouse's employee plan, all right? And if you've got group health insurance and you're approaching Medicare, you need to call me and let's talk about your individual situation, because sometimes when you have group health insurance and are still working, the rules are a little bit different for you. But anybody else who is not working, does not have group health insurance through a spouse who is working, remember, you need to be thinking about the fact that your initial enrollment period for Medicare starts 3 months before the month of your 65th birthday. Now, the only exception to that is if you were born on the first of the month, all right? So say your birthday is August 1st. Well, let me back up a minute. Let me say your birthday is August 15th. So 3 months from August 1st is, let's see, that's July, June, and May, right? May, June, July.
Yes.
Okay. Starting May 1st, if your birthday is August, the middle of August, Medicare becomes effective for you the first week, the first day of August, the first day you turn 65 that month, okay? So, starting in May, one of two things is going to happen. If you are drawing Social Security because you decided to get it early, instead of waiting till later on, if you decided to get Social Security, then within 3 months of your 65th birthday, you should get your Medicare card in the mail. Why? Because Social Security is the arm of the government that handles our enrollment into Social Security. We sign up for Medicare at Social Security. Okay? Now, so if you're getting Social Security already, they already know you're turning 65, so they send you your card automatically. The people I really want to remember this particular point is if you are waiting to draw Social Security, maybe until your full retirement age, which probably is 66, or you're waiting even till 70 to let it grow. Annalee talks about that all the time, how when you wait to draw Social Security, if you do not need it, it could be very beneficial to wait because you get a raise every year from Social Security as it grows. But anyway, so if you're not getting Social Security, you need to be proactive and sign up for Medicare. And you can do that within the 3 months before the month of your 65th birthday. That is called your initial enrollment period. And I bring this up because really, folks, it's amazing how many people come to me and they're not drawing Social Security and they have no idea what they have to do. So I show them in my office exactly how to sign up on the computer. It's very simple to do. But just remember, if you don't have group health insurance and you are not drawing Social Security, you need to sign up for Medicare within those 3 months. Now, the only difference is if your birthday is the first of the month, say it's August 1st, you become eligible for Medicare July 1st. Right? The rules are crazy.
It's confusing.
I mean, they're so confusing. They really are. They're very confusing. And that's why people get confused. It's very understandable. It's very understandable. So anyway, so if you were born the first of the month, then your initial enrollment period actually starts like 3 months before the month before your birthday. Yeah, so if you were born August 1st, your initial enrollment period starts April, May, June, because you're going to get yours July 1st. Okay. Now, if you've got questions, call me. Just call me. Call us here if you got a question or a comment. Call us here at the station, 437-1620. Or if you prefer to call me at my office, call me at 437-3127. Sometimes your very basic question I can answer over the phone. If you've got something a little bit more complicated, maybe it's beneficial to sit face-to-face and make sure we go over everything and make it clear so you don't make a mistake. So, Bridget, there's been a talk in Washington for several years now to notify people, everybody who's turning 65, that Social Security should send them a letter saying, hey, guess what? You're turning 65. Maybe you should think about signing up for Medicare or, find out about it. And, of course, it hasn't gone anywhere. So, we have to rely on word of mouth and education.
That's kind of crazy.
Yeah. Yeah. I wish they would do it. I really do. I think it would avoid some mistakes that people make, because what happens is if they don't sign up when they're supposed to, and then a year later they find out they were supposed to and didn't, they have a penalty.
Really?
Yes.
That was going to be my next question.
Yeah.
What happens if you sign up after?
Yeah. If you sign up after, if you missed your initial enrollment period, and then a year later say, oh, wow, somebody said I should have signed up for Medicare last year and I didn't. And I don't have group health insurance, so I needed to sign up. Now you've got a 10% penalty tacked on to your Medicare Part B premium. And it's 10% for every 12 months you didn't sign up. So,
oh my gosh.
So the standard Medicare Part B premium is $135.50 a month. Okay, that's what you pay to be on Medicare. So 10% of that is what, like $13 roughly. So every year for the rest of your life, you would have that 10% penalty added to your premium. Yep.
That's terrible.
Yeah, well, and you know what the government says, Bridget? What do you think the government says?
Oh, well.
Yeah, exactly.
You should have known.
You should have known.
But how do they know?
So, that's right.
Well, now I would have never known.
It's like a catch-22.
Yeah.
It's like a catch-22. So, yeah, the government never says, oh, I'm so sorry. Just come right down and sign up, because you can't do that either. There's only a special time when you can sign up. So if you've got questions about that, and I have had people in my office who have come to me. I had a couple several years ago. They came in. They were, I think, 68 and 69, and they went to one of my seminars at Sacred Heart out in Destin. And they were sitting there when we were talking about enrolling in Medicare, and he told me when he came in with his wife to see me, he said, we were sitting in the back of the room listening to you, looking at each other saying, hey, we never signed up for Medicare. What is she talking about? Yeah.
Oh, my gosh.
3 years later, they found out. He was self-employed, so, he, I don't know what happened, but anyway, they just didn't know. And it wasn't, it was a legitimate mistake on their part. They just didn't know. But guess what the government said? Oh, sorry.
You missed the boat.
Sorry, you missed the boat. So anyway, they signed up, and now they have a penalty. But they wouldn't have known that had they decided to not go to that presentation I did.
Right.
So, yeah, that was really good.
Gosh.
Can you imagine what that? And that was like 3 years ago. So lucky thing they signed up.
So you can only sign up in that 3-month window before?
Well, you can. It gets confusing because you can sign up your initial enrollment period when you first become eligible for Medicare, which is generally at 65. You have 3 months before, the month of, and 3 months after your 65th birthday. But it doesn't make sense to wait because, first of all, it doesn't start immediately in that next 3 months. So it's always more beneficial to sign up in the first 3 months so that when you turn 65, you have Medicare out there for you. Okay?
I better remember.
But, yeah. But, what you're saying, Bridget, is exactly why people are saying they should be notified, that they might have to take some action.
I completely agree.
Take some action. And they...
Am I supposed to mark it in my calendar now for the year XYZ?
Oh, yeah, what, for another 40 years? Yeah, right. Excuse me.
But seriously, I'm going to remember this. I am.
Okay, good. But, you could probably tell your parents when they get to be 65 what they have to do.
That is very true.
Okay? Yes. Because anybody your age is probably saying, well, Medicare probably wouldn't even be there when I'm 65,
Hey,
right?
you
So
never
who
know.
knows? You don't know. But we know doing everything we can to preserve it. So the other organization I wanted to mention to you is called the Center for Medicare Advocacy. The Center for Medicare Advocacy. And you can go online, just Google it. I think it's .org. It's MedicareAdvocacy.org. And that organization is the one that's very involved in advocating for people to get that letter from Social Security. Okay, they're very active with. I don't want to say what's that when people lobby.
A petition?
Yeah, when they
Something?
lobby.
Yeah, lobby would probably
they're
be.
kind of
That'd be
lobbying,
correct.
but it's a nonprofit organization. But they lobby for us and make sure that the government hears what we're telling them in terms of Medicare. So anyway, I'm going to tell you something about home care in a little while that they have been very, very active in informing people about, and I think I'll save that for after the break. So stay tuned for that, because you're going to want to hear this on home care and some of the myths surrounding home care and what Medicare pays for. So, all right. I wanted to spend a little bit of time talking about some of the things that Medicare doesn't cover, because some people don't realize this until they find out. Medicare, it has two parts, hospital and medical. That's what we prepay for hospital insurance during our working years, so there's no premium for that every month. But Medicare Part B is a premium-based part of Medicare, and that helps us to pay for outpatient kinds of things, care in our home when we need skilled care, and doctor bills. That's a big thing, doctor bills. So we have that, and that's what that covers. But, Medicare doesn't cover vision, doesn't cover routine vision. And it will cover like glaucoma, cataracts, macular degeneration. Why? Because those are medical issues. Those are health issues that many of us experience as we get older. So Medicare covers that. So when you hear that Medicare doesn't cover vision, it's not a blanket thing that it doesn't cover vision. What it really doesn't cover is the routine kind of care. Like if you don't have any medical issues and you want to go get your eyes checked because you're holding the paper further and further away from you and you're not able to see clearly, if you go for an eye exam and it's just a routine eye exam, that doesn't get covered by Medicare insurance. Okay? Yeah. That's for people who have the red, white, and blue card called Original Medicare. That's what I'm talking about here. This is Original Medicare, the red, white, and blue card. I'm not talking about anything else, just that one card. And, I think the statistic is, there's probably, 20% of people on Medicare that only have the red, white, and blue card. And the problem with that is there's no cap to what Medicare expenses can add up to for you. So, for instance, if you only have your Medicare card, and let's say you have a neurosurgical bill, I don't know if this is even logical, but say $100,000. Well, Medicare pays 80% of that. You would pay 20%. So you would have a $20,000 bill, potentially. I mean, that's oversimplified because there's other things that factor in there. But that's basically what happens. And then say in September, you have a heart attack and your doctor bills equal $50,000. Well, 20% of that is $10,000. So that year, you could have $30,000 out of pocket with your only having your Medicare card. That's why people look to get either a supplement to pick up those expenses, to fill in those gaps, to pick up those things that Medicare doesn't cover in full, or they get a Medicare Advantage plan. And that Medicare Advantage plan is from a private insurance company that administers Medicare benefits. But luckily enough, Medicare Advantage plans, as opposed to just the red, white, and blue card, Medicare Advantage plans have a cap to how much you might be on the hook for in a year. So, but the original Medicare card doesn't have a cap. So, that's something to think about. If you've got questions about whether you should have a Medicare supplement or a Medicare Advantage plan, call me at the office, 437-3127, and I can review with you what your options are and how you might be able to protect your pocketbook. All right? So
that's always a good thing.
Yeah, protect your pocketbook. We at Mainstay Financial always want to help you save your money. Save your money as much as possible. So, look at how you can protect yourself from Medicare, high Medicare expenses. So, all right. That being said, we were talking about Medicare doesn't cover routine vision. So, you want to kind of, it's not that expensive to get an eye exam, but what's expensive are getting glasses if you need glasses, okay? So I was looking up today some of the places where you might be able to get assistance with vision care. And one of the places I found online is called preservevisionflorida.org. preservevisionflorida.org. And that website might lead you to some programs that might be able to assist you with paying for vision care. Yep. Just give it a shot. You don't know if you'll find something. A lot of the programs that are listed there are income and asset qualifying, so you have to have certain level of income, certain level of assets, and not above those. So, but still, it's worth it to take a look and just see. The other place I want to tell you about that people might not be aware of is Community Health Northwest Florida. Now, Community Health Northwest Florida is also, it used to be called Community Clinics, I think, but it's now Community Health Northwest Florida, and they have a bunch of services available down there for vision, okay? So you might be able to get some assistance there. And their number is 436-4630. So it's 850-436-4630.
Mm-hmm.
All right. So, and their website is healthcarewithinreach.org.
Yeah, there's a lot of information on here.
Yeah,
I'm looking through it right now.
Good. Yeah, I know that's always helpful, Bridget, when you do that, because then you can, affirm that what I'm saying is actually true.
She is correct.
Yep.
I have verified. It's approved by me.
Very good. Approved by Bridget. Their website, again, it's easy to remember because it's called healthcarewithinreach.org. So that's the Community Health Northwest Florida. So we'll talk a little bit more about that when we come back from the break, because pretty soon we're going to be getting ready for the news. So another agency you might be aware of already, but if not, Northwest Florida Area Agency on Aging, and I'll give you that number when we come back from the news. Okay, so let's see, Bridget, is it going to be? Are we going to be hearing what's going on with the news in just a couple?
In about 45 seconds.
In about 45
what's
seconds.
What's funny about all this is I'm thinking about how eye care isn't affordable, and I wanted glasses so badly when I was in third grade. Right, so. I was a really good kid, but I was like, please, I think I need to get my eyes checked to my mom. And I went and I faked my eye test.
Oh, no.
And they gave me bifocals when I was 9.
Oh, my gosh.
I was 9 or 10, or however you are in third grade. I remember it. And she was like, well, I just paid for these things. You better wear these things.
God, because then you couldn't see.
Her face when she said, you need bifocals. I had to wear them on the tip of my nose, and it's just...
You wanted them because they look cool?
Yeah, I don't know. And I wanted braces, too. I was like, who wants that?
Oh,
who
Bridget,
wants that?
Bridget, I think we have a problem here.
Yeah, I think I'm a little bit of a nerd. That's all I got to say. Well, now it's time.
All I do is win, 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 no matter what. Got money on my mind, I can never get enough. And every time I they stay there, and they stay there, and they stay there. Up, down, up, down. 'Cause all I do is win.
Love it. That'll get you so amped up on a Tuesday. It's
That
great.
is so funny because that's just like Annalee's signature, one of Annalee's signature songs. So.
I feel like that's like her walk-in song
Yeah, I
when she
know.
walks in the office. It probably plays behind her.
Too funny. All right. Well, welcome back to Winning with Annalee. I am your substitute host today, Joan Connell, Annalee's business partner at Mainstay Financial on the corner of Perry and Cervantes. And I had a bunch of things I wanted to talk about today, but so far I've only gotten through like 2 things. You know, what's
time
with that,
flies.
Bridget? Time flies when
Because
you're
we're
having
too much fun. Exactly.
Oh, my goodness. All right. Before the break, I promised you I would make sure you had the number for the Northwest Florida Area Agency on Aging. And that number is 494-7100. 494-7100. And the Area Agency on Aging sometimes is a place where you can start to, if you need some help with, paying for something, wondering about home care, almost anything, you can call them and they will probably be able to direct you to the appropriate either department or person within their agency or even to another community agency. They are also members of our Escarosa Senior Alliance. You know, the Escarosa Senior Alliance is the group that Annalee and I formed back in 2010, and it's a bunch of experienced, knowledgeable professionals who really work in senior care roles. So we've got people in our alliance who, for instance, Annalee, financial planner, myself, Medicare and long-term care specialist. We have John Horton, whom many of you probably have heard of or might know. John Horton has a business called Assisted Living Locators. And John is really a very busy man because there are so many people that don't know where to start when they either they recognize they can't really stay in their own home, or they have a relative or a friend who is in that same situation. John can help you figure that kind of thing out. Some other people we have in our alliance, we have a gentleman who does reverse mortgages. We have a pharmacist, and we have a tax lady. We have a lady who helps you downsize and organize in your home. Because one of the problems, Bridget, that happens as we get older, first of all, we all tend to collect way too much stuff, right? I think many of us are in that situation. But what happens as we get older, sometimes our homes become unsafe because we either have clutter that we're not able to take care of ourselves, either because of physical limitations or inabilities. And Sharon Davis can help you with that. She's a member of our alliance. She can help assess your situation and help you kind of clean up. We have people in this community who we know have a hoarding problem.
Yeah.
I mean, it's an issue for many people. Sharon works with people who have a hoarding issue if they are ready to kind of clean things up for themselves. So anyway, if you've got questions, our alliance number, I'm giving you a ton of numbers today, but that's my point today. I want you to be aware of what's out there to help you if you've got particular issues. And if you have any kind of question at all, you can call me at 437-3127 and discuss maybe your particular issue, and I can help refer you to the appropriate person in our alliance.
Great.
Okay? So please feel free. If you think you need some help with something, we most probably have the person we can tell you who to call. Okay? So 437-3127. All right. So anyway, we know that vision is not really covered unless you have a medical issue. What about dental? That's another question people ask me about. Well, does Medicare cover dental? And basically, the red, white, and blue original Medicare card basically doesn't cover dental. It will cover dental if there's a medical issue. Like, say, for instance, somebody's going to have open heart surgery and they have an infected tooth, just as an example. Medicare will help with getting that tooth removed or treated so the person can have the heart surgery.
Okay.
So they're not at risk for, post-op complications. But if you are just wanting to go to the dentist to get a cleaning, Medicare just doesn't cover that. So that's an out-of-pocket expense for you. Now, Medicare Advantage plans, many of them have dental coverage, and that can be a benefit to you. However, you have to check with your plan because Medicare Advantage plans are what we call network-based. So either the dentist you would like to go to or that you're currently going to might not be in that plan's network. Consequently, you might have to pay out-of-network prices, which could be less than what the dentist charges, but still. But if you go to an in-network dentist, then you will have a certain copay. So you need to check with your plan and find out, okay, who's in the dental network for my particular Medicare Advantage plan. So that's always a very important thing that you should ask about when you are enrolling in a Medicare Advantage plan. So remember, original Medicare doesn't cover routine dental or even any kind of comprehensive dental unless you've got a medical issue that has to be cleared up before something else can take place. So Medicare supplements that work with the original Medicare card, they don't cover dental either. Because if Medicare doesn't cover something, neither does the Medicare supplement. So just FYI to be aware of that, okay? Now, what can you do? I mean, where can you go to get dental services? Well, one of the first places I think about is what about the dental hygiene program over at Pensacola State? You know, all of those students have to have experience. Now, I don't know whether they still have the clinic over there, but you might want to call Pensacola State, the dental program, and I'm sorry I don't have a number for that, and just see whether or not they accept people from the community coming in so the students can get more experience. So again, I might be giving you wrong information about that, but that's the first thing I thought about. We don't have any dental schools in this area, so it's hard for somebody to go to a dental school for comprehensive dental surgery procedures. Anyway, let me look at one other thing here. Let's see.
I actually think I found an email they can email to see inquiries about that. Health programs at pensacolaState.edu.
Oh, perfect. That's great. Thanks, Bridget.
You're welcome. Or you can also call, I guess, 850-484-1625. So those are the people.
1625. Good. Excellent.
Those are the people.
Check it out and find out. You know, you never know. It's interesting, Bridget. You know, a lot of people... medical tourism is an industry. In other words, people go to another country to get medical care.
Yeah.
And from what I was reading from this Certified Senior Advisor website, the medical tourism for dental care is fairly common. And top destinations are Mexico and Costa Rica.
Really?
Yeah. Isn't that amazing? That's amazing. Both countries accept U.S. dollars. And if you have a health savings account, you might even be able to use that to pay for your expenses.
Going all the way to Mexico to see the dentist.
I know.
Going to the dentist is hard enough.
I know. Here's another thing that I thought was interesting. I read this, again, from the Certified Senior Advisor website. Latest research shows, and all my dental friends are probably going to be having a heart attack when I read this one, but the latest research shows you really only have to visit once a year to get the same benefits provided by recommended twice-yearly cleanings. Isn't that interesting?
Wow.
I am going to have to ask my good friend Dr. Barano, my dentist in Gulf Breeze, about that. And she's been on the show with Annalee before, so we talk about senior dental health.
That's funny.
Mm-hmm. So... isn't that amazing? Have to only visit once a year. I'll have to look and see where that came from in terms of where that research came from.
Yeah, definitely ask. Right. I'm interested to know.
All right. Now, that's all I'm going to say about the things that original Medicare doesn't cover. All right. I've given you some options for vision and dental. So the other thing is you might want to investigate insurance companies, because insurance companies have dental plans, vision plans, all those kinds of things that might provide some additional benefit to you. So if you've got questions about that, you can call me at the office, 437-3127, because I can talk to you about that and might be able to assist you. So, all right. If you've got questions or comments, remember you can text us here at the station, or you can call us, 437-1620, and just let us know if you've got anything out there.
We would prefer a phone call, because I don't know if our texting is
texting might be a little off now? Okay.
Yep.
All right. So, now, here's something else I want people to know. This, remember I mentioned Center for Medicare Advocacy? Okay. They have put out some materials about, I have always thought that when you're getting home health care, in other words, skilled care in your home, maybe you need physical therapy, you need a nurse to come in to change dressings, those kinds of things, skilled care, not just care because you can't bathe yourself, all right? You might not be able to bathe yourself when you're getting skilled care, but I was always under the impression that if you weren't making progress and getting better, that Medicare would say, we're not going to cover you anymore.
Yeah.
Well, guess what, folks? I found out about 4 weeks ago from the Center for Medicare Advocacy that there was a district court settlement in 2013, and it's called Jimmo versus Sibelius. Now, you don't need to remember that, okay? But it's actually a court settlement. And the settlement required that Medicare coverage is determined by a beneficiary's need for skilled care, not on a beneficiary's potential for improvement. Okay, that's what the case was based on. Medicare policy now clearly states, and this is a quote from CMS, service does not turn on the presence or absence of a beneficiary's potential for improvement, but rather on the beneficiary's need for skilled care. Skilled care may be necessary to improve a patient's condition, to maintain a patient's current condition, or to prevent or slow further deterioration of a patient's condition. Now, what's really interesting is the Center for Medicare Advocacy did a survey of providers, like home health people in that area. In 2018, they did a national survey, and the results said 40% of responders had not heard about this settlement, and 30% of them weren't aware that Medicare coverage does not depend on a beneficiary's potential for improvement. Now, why is that important? To me, that's important because if you are getting care in your home from a home health agency, and the home health agency says, Medicare's not going to cover anything anymore because you're not making any more improvement, you might want to question the home health agency about that and tell them that Medicare says you might still be able to continue your coverage in your home to prevent further decline. Now, it's hard to go into any kind of details about this, but I want you to be aware of it because I don't think a lot of people know this. I know I didn't. And when I was teaching my classes, that's exactly what I would say. Medicare will pay for home health as long as you're getting better. Well, a lot of people aren't going to get better. And if they don't continue the service, they're going to get worse. And Bridget, it only makes sense because if somebody's getting some care in their home and then they don't get it anymore and they get worse, where are they going to wind up? Back in the hospital.
That's true.
So
it's terrible.
It really does make sense, actually, now that you think about it. So if you have questions about this, you call me because I can give you the fact sheet from the Center for Medicare Advocacy that literally talks about this particular settlement. All right? So, now, to get home health care, and home health care is when you are getting skilled care. That's different than home care, because home care is where you have an agency like Home Instead. They provide home care in the home. And what kind of care do they provide? They provide, help with bathing and dressing and, homemaker services, all those kinds of things that are designed to help the primary caregiver get a break, so to speak, so that they don't have to be doing those things. And maybe you can go to work and leave your loved one home because Home Instead is going to be there. And Home Instead, by the way, is a member of our Senior Alliance.
Okay, cool.
So we know and trust them, and we know that their caregivers do a great job. Anyway, so to get home health care from a home health agency, this is the requirement. You have to be homebound. Now, that doesn't mean you can never go out. You could go out for doctor visits. You can take a short duration, like a walk around the block, or attend a family occasion. It doesn't mean that you have to always stay in the home or be bedbound, but you have to be homebound. Now, a physician has to order the care. Now, that's different than what Stacy and her team at Home Instead does. You can call and ask for them to come in your home, whereas for home health care, the doctor has to write the order.
So,
all right? So, yeah.
I actually have a question about this. Like, if you need, like, physical therapy in the home, of like my grandma's having knee surgery potentially. So would this have to be something the doctor orders for her, and then Medicare would then cover that?
That's exactly right.
Okay.
That's exactly right. And that's what happens to a lot of people, Bridget. They go to have like a knee replaced. Some people have double knee replacements at the same time. And what are they going to do? They're going to need some physical therapy. So they can either go to a facility for rehab and stay overnight for several weeks maybe for rehab. Yeah. A lot of people, if they want and like to, they can go home if the doctor says it's okay. But then the doctor will order care to be given in the home, like the physical therapy.
And then Medicare would cover
yeah,
the
depending
order.
on what plan she's got. Yeah.
Okay, cool.
Okay?
Great.
So good question. Now, here's the other thing. The physician or a health professional had to have a face-to-face meeting with the individual prior to certifying that the person needs care in the home. So like in your grandmother's situation, the social worker would, or whoever it is in the hospital, if she's going to a hospital, would meet with her and say, oh, yeah, and the doctor says you need physical therapy, and then the social worker will put her in touch with a home health agency
Got it.
that will send in the physical therapist.
Got it.
Okay? So, and that kind of care has to be provided by a Medicare certified home health agency. Okay? So there's all kinds of rules about this, but the bottom line is we need to be aware of the fact that skilled care for home care can also be used to prevent further decline. And again, your home health agency will have to work with you on getting recertified, because when you get care in your home, it's my understanding that you get like certified for a certain period of time, and then or a number of visits, however they work it. And then once those visits are over a period of time, then they're either out of there because you don't need it anymore, or you still need it because you need to get further along or prevent further decline.
Got it.
So, yeah. So, if you want more information about this, I want you to call me at the office, 437-3127, and I can send you these 2 fact sheets that literally set out the details about this particular court settlement, and they're trying to generate awareness among providers as well as beneficiaries about this. Okay, so that's why I wanted to share that with you today, so you would kind of understand that maybe you can get additional help. I'll tell you, it's interesting. I was at a meeting a couple of weeks ago with a woman who has her mother who has dementia. She can't be left alone. She needs somebody to come and stay with her when she's out of the house. But she was told that, skilled care is not appropriate for her mother. But in this settlement, they're saying it could possibly be okay.
Oh, good.
So I sent her this information the other day, so she's going to work with her home health care agency and see if there's something they can do, and her physician, to see if they can get it recertified for her mother. And the kind of skilled care she might need would be physical therapy. I mean, maybe the mother needs to get some exercise, to give her some stimulation, I guess. I don't know. But anyway.
Out of my wheelhouse.
Out of my wheelhouse, too. That's right. Thank you. Good. All right. So we're kind of winding down here. I'm going to give you some information about what's happening. The first thing I want you to start thinking about is Saturday, April 27th is going to be our Power of E3 Day at Sacred Heart in the Green Hut Auditorium, Saturday, March 27th. And we're going to do it a little differently this year because people have given us feedback that maybe we should make the day a little bit shorter. So we are shortening the day. It's going to be 8:30 to 12:30. And this year we will have a kind of like a keynote speaker, but the focus is going to be on health and wellness for women 55 and over. And, of course, you don't have to be 55 and over to come, okay? But just be aware that the focus is for women as they begin to go past 55 and on up in the years. So, again, that's Saturday, April 27th at Sacred Heart. Tickets are available on the powerofE3.com website, powerofE3.com website, or you can call us at the office, 437-3127, and we'll get you set up with what you need. All right? Now, let's see. What about Medicare Made Easy? Oh, my goodness, that's my class, and I'm teaching that on March 7th from 5:30 to 7:30 over at Coastal Alabama Community College in Gulf Shores. So if you're able to hear our show today, hopefully you'll be hearing that, and we'll maybe see you at that class. Oh, let's see. What else? And in March, we have other things coming up, too. I think it's a little too soon to announce those, so we're going to hold off, and we'll let Annalee talk about what she's going to be teaching in March when she comes back next week.
Great.
Okay, does that sound like a plan?
Absolutely.
Yeah.
And I just want to let all our listeners know, if you want any of the information, any of the phone numbers that Joan talked about today or the websites, this is also going to be available as a podcast on our website.
Oh, good. Good. All right, very good. And remember, you can always visit us at Mainstay FG, Mainstay Financial Group, mainstayfg.com. All right? Let's see what else. What else should I tell you about? Oh, and Annalee says if you want to receive the first chapter of her book, go to the website and request it. Okay? And I think that's pretty much it for today. I think we've wrapped up things.
I think you gave us a lot of great information.
I know, a lot of stuff. And we wish everybody a wonderful day, a wonderful week. Thank you to everyone in the office, Bo, Jolie, and Bella, the Smile Committee. Have a great week. Be kind to each other. And we'll be back with you next week. Bye.
All right. Everybody have a good day. You're listening to News Radio 92.3.